In 2019, Everson Bwenje, a resident of Tula in Kawempe Division, Kampala City, started experiencing body weakness which kept worsening until one day she discovered a lump in her left breast.
Just feeling my breast like this, I felt I had big mass, a lump. It was so scary. It was a Sunday. Monday, I was so busy. Tuesday, I went to the hospital. I went to IHK.
She was informed that everything was normal, but she insisted on the doctor performing a scan on her breasts.
And the doctor was like, your white blood cells are quite low, high. It's like they're trying to protect or to attack a certain. They've been attacked. I did the scan. The face expression of the radiologist was saying something serious.
The doctor advised her to do a biopsy. Out of fear, Bwenje decided to seek a second opinion. However, the results were the same. She had a biopsy and the results were positive. She had breast cancer.
It was so heartbreaking. I asked God, I said, God, if at all you wanted to give me a very hard disease, I wish you gave me HIV instead of cancer.
She was advised that her breast needed to be cut off. However, friends told her the best option was to use herbal medicine. She spent a lot of money buying herbs in vain.
And I did local herbs for 2 good months. From Nakulabye, from Kasubi, from Uganda, I did, but nothing. And the truth is, the lump was increasing.
Eventually, Bwenje ended up at the Uganda Cancer Institute.
They decided I start with chemo other than the surgery. I lost all my hair, I swell, my cheeks were big. It was an ugly moment. Even the skin, it would peel. It reached to that extent, it was so bad to the extent that every day they had to change their bed sheets.
According to the Regional Cancer Spectrum in Uganda, a population-based cancer survey by sub-regions published last year in A Cancer Medical Science, an open-access cancer journal focused on under-resourced communities, women are carrying the cancer burden. A total of 25,576 cancer cases were registered. Of these, 14,322, which is 56%, were female, while male cancers were 11,254, which is 44%. The top 5 female cancers in all the sub-regions included cervical cancer, 43%, breast cancer at 22%, esophagus 5.6%, ovary 5.2%, Kaposi sarcoma 4.7%, and other less common cancers at 18.5%.
Among the top 3 cancers, 2 of them are in women. It doesn't mean men don't suffer from cancer, but it means that when you see patients with cancer, majority are likely to be women.
In men, the top 5 cancers included prostate cancer at 25.1%, esophagus 15.1%, Kaposi sarcoma 12.4%, liver 8.8%, stomach 4.8%, and other less common male cancers accounting for 33.8%.
The cancer.
According to Dr. Noleb Mugisha, the in charge of the National Cancer Control Planning and the head of the Comprehensive Community Cancer Program (CCCP) at the Uganda Cancer Institute, ovarian cancer has emerged as one of the most common female cancers in all sub-regions of Uganda.
Cancer of the ovary is highly associated with what we call unbalanced estrogen. If a woman has their first child after the age of 40, we know that their risk for ovarian cancer, their risk for breast cancer is higher.
In Uganda, non-communicable diseases account for 33% of mortalities every year, and cancers contribute about 1/3 of these deaths. Dr. Mugisha appeals to the public to embrace cancer screening even when they're not feeling sick, because cancer is on the rise in Uganda due to the lifestyle changes people have taken on.
These days I tell my fellow men that we can treat cancer of the prostate when it's early without surgery. and we can preserve a man's sexual function up to 85%, you know. That used not to be the story.
After 6 cycles of chemotherapy, Bwenje's breast was successfully removed in 2023.
Physically you change, mentally you have to change. Most people, even financially, you change because some lose jobs. Some even are deserted by their families, by their husbands. Remember, you've changed. They've removed a breast or both of them.
According to the study, cancer-related mortalities and survival at Uganda Cancer Institute are 80% and 20% respectively. The study also highlights the fact that stomach cancer is emerging among the most common cancers in both males and females in the Kigezi and Ankole sub-regions.
One, we think they use a lot of rock salt. You know rock salt that is used to cook beans? Chisula. Another reason could be the distribution of H. pylori. H. pylori is a bacteria that actually causes ulceration in the stomach.
Overall, the top 5 high cancer burden districts by crude cancer incidence rates are Kampala at 86.6, Gulu at 73.6, Kabale at 68.1, Uganda at 62.2, and Bushenyi at 56 cancer cases for every 100,000 people.